Day in my life as a Pentacam. I'm turned on bright and early in the morning by Michaela Haar, who is a third-year optometry student. We are able to perform our work together at the Kentucky College of Optometry. We have our first patient of the day, and we are monitoring her for keratoconus. My holiday report shows axial and tangential maps along with pachymetry and elevation maps to help us diagnose and monitor the condition. Next up is the Balin-Ambrosio ectasia display, and this is also useful in diagnosing keratoconus. This patient has severe corneal scarring and thinning from a corneal ulcer. With Scheimpflug images, we can identify which corneal layers are affected and measure the corneal pachymetry in a specific area. These images are also useful when fitting scleral lenses. You can use this caliper tool to measure the lens clearance during the fitting process. That patient had adequate clearance. Shoo, it's been a long morning, and performing these scans, I'm ready for a lunch break. Back from lunch, and it's time to perform my next scan. Look at the long list of data I can provide you with. My next scan allows us to observe and measure the patient's anterior chamber angles. This patient has open angles, but this could be useful to monitor patients with narrow angles and diagnose angle closure glaucoma. Next up is a patient with Fuchs dystrophy. My comparison map allows us to monitor changes in corneal thickness and edema over time. I show Michaela this patient's edema has improved by over 200 microns. It's been a long day performing these scans. I'm ready for some sleep. Michaela turns me off and covers me up for the night. The lights are then flipped off and I rest until tomorrow when we come back for another